Hi, and welcome to A View from the Bed. This is the CHI St. Vincent podcast where we talk to real patients about their healthcare perspective. We know that your healthcare journey can be scary, so that's why we want to get their view on the good, the bad, and the ugly from diagnosis to recovery. Enjoy today's episode. Hey guys, thank you for tuning in to the podcast today. Today we have a cool story. We're talking to Nick. And when you look at him, you might not think he's a traditional colorectal surgery patient, but here he is, and he's going to share his story with us. So thank you for being here, Nick, and for talking to us.
Thank you for having me.
Yeah. So, okay, tell us, where did your journey begin? Like, where did it all kind of start?
So it really is kind of like a crazy story. So I started having pain in around 2023. I kind of felt it that summer when I go golfing a little bit, didn't think nothing about it. Then by Thanksgiving, I felt it more. After that, I kind of called because I did have a family history of colon cancer. My mom's dad passed away from it in 83, so I never knew him. But after that, I scheduled my colonoscopy, and I scheduled my consultation for January. So I actually went January 10th to meet with that doctor. So I'd gone through the symptoms for probably 2 or 3 months where I could feel it in back pain. When saw my primary doctor, I'd had some blood in my stool and in my urine. Okay. So my primary doctor also told me I needed to go see, because I have had kidney stones in the past, a urologist. So I'd scheduled to knock out both appointments in one day because I've got a busy schedule. So January 10th of 24, I went and I saw the urologist. I saw the colonoscopy. I saw Dr. Pennington, my GI doctor, that morning, and then that afternoon I went and saw my urologist, and then they scheduled the CT scan. And after they scheduled the CT scan, then they found the mass, and they called me to come in on the 11th. So mine all happened like really, really fast. So I found out that I went to get information on what was going on with me on the 10th. Found out on the 11th that morning at 8 o'clock. I called Gastro Arkansas with Dr. Pennington. They got me in for a colonoscopy on the 12th, I guess. Okay. So I told them on the 11th. And then I also reached out to a friend who said, hey, let me send this to Dr. Raley or whatever, see if we have any openings. We all had an opening on January 22nd. Okay. So then on January 22nd, I, had surgery, and they got it. It was stage 2, the size of a baseball.
Oh my God. We're going to backtrack a little bit. So when you said, because one, you're pretty young.
Yeah.
And so you're well below the age.
I was 32.
That you normally need a colonoscopy.
Mm-hmm.
So describe a little bit like what the pain was like. Like, where was your pain?
So I had pain on my side, like right there, because mine was on the right side of my colon. And then I had back pain. So I had a lot of back pain. And I actually, in college, I'm blessed to not be paralyzed because I broke my T12 sledding in Fayetteville. So I thought it might have to do with that. So I was like, the weather, wintertime, it gets a little tighter. So it just felt like it was more than normal. Yeah. And I mean, I really just had the pain in those 2 areas.
So the pain, would it just come and go? Or did you notice, like, if you're being more active?
If I was more active, I was more fatigued. So like something as simple as like when you're going deer hunting and you're walking to the blind, like I noticed, like literally I was like out of breath, and I was like, I need to lose weight, because I was like, I put on some weight. Maybe this is what is causing it. Yeah. And then it was more or less, no, what caused that was having cancer.
Yeah, you had a baseball size tumor.
And it hurt whenever I would go golfing in the fall. Like I'd be tired when I was out there, and I was like, why am I so tired from golfing?
Well, yeah.
And I was like, but I thought it was, I need to lose weight, but it was cancer.
Did you ever talk to your primary care doctor about it?
I did, and that's what she was like, I think you need to go you may have kidney stones back there causing the back pain. Okay. Or she also thought it might have to do with my back, because like I said, I had 2 rods in a cage. I didn't say that, but I have 2 rods in a cage back there from fracturing my T12. So
yeah, back pain, you're not.
I'm kind of used to.
Yeah, like you're no stranger to back pain.
Yep, no stranger at all.
So, you bring up a really good point for our viewers and listeners, because, you had these kind of symptoms that could be multiple things, especially with your history of other conditions. And so it was really good that you decided to just really talk to your doctor to start the process. Now, granted, you probably didn't want to go to see as many doctors as you had to find out what was going on.
You see a lot more after you find out what's going on.
Because you're like, man, I'm going to take the day off so I could just go do my doctor day, to figure everything out. So, you bring up a good point because you talk about the colonoscopy. And one of the things that we hear a lot, especially in healthcare, is I don't want to get a colonoscopy because the prep is horrible. So tell us a little bit.
So the thing about the prep, and I guess I'm probably going to give a shameless plug here to whatever pills they've came up with.
Yeah.
And your insurance company probably doesn't want to hear that, but they've got pills now. So the prep with the pills. So I threw up a lot on that first one. So whenever I could get in for the colonoscopy, but now they kind of give me, because it was so rough on me, I get pills. So the prep's not near as bad.
So that's a good call out though. And I'm glad you're sharing that about, people only think of the big giant liquid jug that they've always heard of with the prep. But, it's important to know that there are different kinds of prep methods nowadays. And Nick, just mentioned now there are pills. And so I just learned about this morning. So let me tell you about these cool little pills. So these pills all day, you don't eat food, but you drink pretty much whatever you want to. Okay. There's no color restrictions. There's, if you like diet soda or soda, you can have a soda. But then at 4:00 in the afternoon, you start taking these pills and you take one pill every about 2 minutes and you take 2 bottles of it. And it equates to like 24 pills.
Yes.
And then there you go. You're just going to start your,
you need to be close to the rest. You need to be close to the bathroom.
So lots of toilet paper needs to be in your house on prep day, but you do it the day before you go to have your colonoscopy.
Yep.
Then you wake up after you're all nice and clean, if you slept, because, toilet time could take a while. And then you go do your colonoscopy. And then once you're good with your colonoscopy, if you don't have, a baseball-sized tumor that's cancerous, generally you can eat and drink after, you recover from that. But so a good plug here from Nick, there are lots of prep methods that aren't as bad as they used to. So don't believe all the horror stories. Talk to your doctor about what method can work for you.
Yep.
So you got through the colonoscopy and you met with Dr. Raley literally like a week later.
I don't even know I think I came in and met with him whenever it was during the snow. So I found out right before we had that snowstorm hit.
Okay.
And then I think I was supposed to meet with him on a Tuesday or something because him and Pennington talked and he was like, I'm confident I can get this. And he got it.
Yeah.
But I think I met with him the Friday before I had the procedure on a Monday.
Okay.
So it all happened very fast.
It was very quick. I mean, within 15 days from start to finish, which is kind of crazy.
Mm-hmm.
So tell us a little bit about the surgery part, because, that's the other thing. People, when you go to the doctor, you do all these preventative things, but you never want to hear you have a tumor. You definitely never want to hear the C word, cancer.
It's true.
And so tell us a little bit about what were your emotions? What was going on in your mind when you got that?
Whenever I got told that I have a mass after they found the CT at Arkansas Urology, was I had my 2-year-old with me. So the first thing that's popping in my eyes as a dad is am I going to be here for my daughter?
Yeah.
Am I going to be here for my son? And am I going to be here for my wife? So that's where it hits you from the emotional part is a father and a provider and a protector is who's going to be there to protect them and provide. So I still kind of get a little bit emotional thinking about that because it was me and my daughter and the other person and the doctor that was telling me in the room. And my wife was like, do you want me to go with you and meet you there? I was like, no, it's fine. They're going to tell me to bring somebody if it's something bad. Well, no, they actually don't because they don't want to alarm you. So
they don't.
If they tell you to come right away, bring somebody with you because then I'm trying to drive and
2-year-old.
I've got a 2-year-old with me who's throwing all her bracelets on the floor Daddy, look at my bracelets. And you're like, can you explain to me what you just told me again? And you said and you're sure it's they're like, yes, it's the size of a peach. I was like, oh.
You're like, okay.
Can you call my wife? So then I'm calling her, and then they're telling her, and then there was a lot of emotions going on in that time period.
Yeah.
That first initial part.
And you're trying to hold it together because you have your 2-year-old.
Yes.
And your wife on the phone, and your poor wife is probably like, oh Lord, how's he going to drive home? Like, how's he?
Yes. And I think she was probably more scattered driving home than I was, because I was just like, what if this is like one of my last tries? I mean, because you hear that it's that big, because it was pretty much almost obstructing it. So, I mean, it was, I think, 7.7 centimeters. I mean, it was a good size.
That's a good size.
Yeah.
Yeah, tumor. That is.
It ended up being bigger when he took it. So, but yeah.
So, knowing you have this family history, like, who was your next call after you and your wife found out?
So the weird thing is I actually rushed to call my dad, who was with my mom, who was getting a colonoscopy with Pennington at that exact time.
Oh, well, that's comforting.
Yes. So it was one of those things like,
okay.
Yes, she didn't have polyps, I don't think, last year, than she did this year. So she's on the same track as me now. She's got to go every year.
Every year.
Yeah, she gave me I actually have a gene. So that's the one thing we found out later on, was that we have this thing called Lynch syndrome that runs in our family.
Okay.
So
you have the carrier gene that, makes you prone to have cancer.
Yes.
Yeah, which that's fun to also learn.
But that's the thing is with technology and everything today, with able to get colonoscopies, like, I shouldn't have a problem. And I have doctors that are going to stay on top of everything.
Yeah. Well, and the point of all of it too is that you paid attention to your body.
Yes.
And to your symptoms, and you knew something wasn't right.
Mm-hmm.
But then you also had conversations to know you had a family history.
Yep.
And so, if you can have those conversations are so good. Now, obviously, there are times you can't have those conversations, and doctors understand that. But just tell them, I don't know, I don't know my birth parents, or I don't know my birth siblings, or maybe they passed at a much younger age, and they didn't get to an age that they would have found out if something, was there. So just be honest with them. Hey, I'm not sure what's going on here. But maybe this could be a good idea. The other good questions to ask too is, when I was talking to Dr. Raley, is, if you have siblings, maybe not a parent that has a history of polyps, but you have siblings that have a history of polyps, does that increase your chances for needing to get an earlier colonoscopy? Or if you have polyps in another part of your body, if you have sinus polyps or cervical polyps or any other polyps, does that make you more prone for, polyps in the colon? So just have those conversations with your doctor, with your primary care doctor or your GI doctor, to make sure that they understand everything going on for that full picture.
Yeah.
Were there any conversations you had with Dr. Raley? I mean, I know you met him at a point to where you already knew there was a mass, but are there any weird conversations that you have in follow-ups that you could share with viewers to be prepared for?
I really don't know that I had any weird conversations. I mean, Dr. Raley probably was like, this guy thinks I walk on water, because I really did. I mean, I had stage 2 colon cancer. It went through the colon wall. The size ended up being the size of a baseball. He took a foot of my colon, and I didn't have to have chemo.
That's amazing.
Yeah, it really is, and he is the best.
Yeah.
So I mean, I'm giving him a shameless plug. I told him I always would. So.
Well, good. No.
But honestly, like, he literally, it saved my life. It had already went from like the size of a peach to the size of a baseball in 11, or, they said the CT might not get the exact measurements right, but. It was the size of a baseball when he took it. It went through the colon wall. It had not spread through the lymph nodes yet.
Good.
So I'm really blessed. I was back to work in like 3 weeks.
Oh.
Which, real estate, I was taking phone calls like the next in the hospital, but that's a different story.
Yeah.
But for my other job, I was back to work by February 18th. So,
wow.
Like that's how, I would say like my recovery was rapid. And he was a great surgeon. He did a great job. I healed fast. My incisions and everything healed fast. And
that's amazing. So when he took a foot of the colon, did you have to have any kind of like temporary ostomy or?
No.
Tell us a little bit about that recovery period after.
The surgery for the hemicolectomy is rough. So I also have a problem with like acid, I guess, in my stomach.
Okay.
I don't know what causes that, but like I was really nauseous.
Okay.
So like I had great nurses here too. That one of them suggested after a couple of days of me struggling with nausea was to put on a C patch.
Oh yeah.
A scopolamine patch, I think, and they put that on right there, and that helped. And I was on some nausea medicines, but I mean that the surgery was rough to recover from.
Sure.
But like as far as like the long term, I mean, after a week I was recovered.
Oh.
So I mean, when you say it was rough initially. So if you're having a hemicolectomy, make sure that like whenever you first start to eat stuff, you stick to eating something very light. I think I did that. Because I thought I'm Superman. I walked 8 times the first day after surgery.
Oh, wow. That's a lot.
Yeah, and then I didn't walk 8 times the rest of the week, probably around the building.
Yeah.
Whenever those things wear off, like you feel it.
Oh, yeah. So. You start to feel it. And you're like, probably should not have done that.
Probably should not have overdone it. But I was like, I'm going to be out of here. Like, I'm taking pictures everybody wants to see on Facebook and social media. You're like, I got this. Yeah, cheese.
Yeah. And then you're like, oh, never mind.
And then the next day, that next night, you're like, pushing the button for the nurse because you're having
problems.
Yeah, but I had a great stay here, and the nurses were phenomenal. Dr. Raley's the best surgeon in my eyes, but I mean that's because he really did save my life and had me back to normal in less than a month. That's amazing.
You know, when you went home, how important is it for you to have somebody there with you that can just help you do things while you recover?
I would say it's very important, especially if you have kids that want to try to crawl all over you. So, yeah.
So maybe have somebody watch the kids or help with the kids.
My wife was incredible. She did a lot around the house. She was very good at that.
Were you on regular kind of surgical restrictions, such as no lifting heavy objects?
No lifting heavy objects, and I stayed on that for I want to say 6 to 8 weeks or something.
Okay.
But it was like I also tried to I try to push myself sometimes too much. So in March I tried to work out and I went to the gym and I didn't do that again for a few months, as we can all see. I haven't really ever got back in that.
Yeah.
But like, I mean, you have to follow the restrictions and listen to your doctors on what they tell you to do.
Yeah, because you definitely don't want to hurt or injure anything in the healing process. With the incisions, was it laparoscopic?
Yes.
You have the large incision?
Yes, it was laparoscopic. So you get there was 3 on my left side and a bigger one, I think, on my right side.
Okay.
Was it below the belly button?
The belly button area?
Yep. So.
Well, that's good because I'll tell you what, these surgeons amaze me with what they can do laparoscopically, because if you think of a foot of colon and all they have are these, really 4 little puncture holes.
Mm-hmm.
I mean, part of you has to be like, how did they get that out of there? Or how did they get a baseball-sized, tumor out of those little holes? But they do. It's amazing how they do that.
Yeah.
And then eventually you don't even see the scars, as you heal, and which is very cool.
Mm.
So your story is just very phenomenal. So now that you're recovered, you're feeling great, you said you go back once a year to do a colonoscopy?
Yes, and then I'm at the car tie with Dr. Gentry, and she's been phenomenal too. She stays on top of that. And I've had, a PET scan and a couple CT scans, and everything's been clear.
Okay.
So I mean, it's been incredible. I've had incredible doctors. My primary care doctor stays on top of me too. So I mean, I know between all of the doctors now that they're on top of everything.
Yeah.
To where hopefully I don't have to see Dr. Raley again, but I can still talk about how great he is.
That's true. You can. And if maybe next time you just see him, maybe it's at a restaurant or something.
Yes.
Yeah. Yeah. Not when you have a cancer.
The weird thing, I wouldn't say crazy, is about how many times you meet people afterwards and you start talking about, they know you had a hemicolectomy, and people for Crohn's and other stuff, and they're like, I had Dr. Raley too. And every time that story's been, it's been like, he's the best. And that's kind of how that conversation goes. And I've heard that also about Dr. Burns as well here. Yeah. So I mean, y'all are blessed to have a great team of surgeons.
We are very blessed.
Some of the best in the world right here in Little Rock.
We do. And I tell you what, just like Nick mentioned, anytime you have to have any kind of colon resection where they remove part of your colon, regardless of if it's from a mass or, you mentioned Crohn's or, there are some diverticulitis or other things that can cause that. Having the right surgeon is so imperative for that scar tissue and just making sure that, let's be honest, potty time is a big part of our lives. And if you don't poop, you can die. And so, just making sure everything's put back together correctly is so important. And you never realize how important your pooping is until you go see somebody like Dr. Raley.
Yeah.
Who that is all they do. Like all day. They just ask people questions about their poop history and things that are going on. And we need to normalize talking about these things because if something doesn't feel right or look right, you need to say something. Yeah. And it's not embarrassing because these doctors, that is what they do. So if it looks abnormal, feels abnormal, your body, something's going on and it's not right, say something.
Yeah. And that's the thing too, is you have a lot of people that'll have pain in their abdomen and stuff. And they'll think I was lifting something too heavy and I got a hernia or I got something like that. And one of my good friends and a mentor to me when I got into real estate, actually passed away of colon cancer.
Oh, wow.
So that he passed away in 21. So I think that's why I was more prone when I had them problems. Like, all right, I'm gonna start asking questions.
Yeah.
And then, I did let it slide a little bit. It was at the stage 2 point before but as soon as I started feeling it and started noticing my stool, I did get in, and that's why I'm here today.
Yeah.
And it can move fast. So my advice to everybody is if you have the pain in that area, make sure you go see a doctor to where they'll do a CT scan, to where they'll look at it and see if you have something there. If they do, then you go about it, the process as quickly as possible to trying to do if you're going to have chemo or something before you have the surgery, to do whatever you need to do to where you can get to surgery. Because if you get to surgery, the surgeons are so good now. You have a really good shot at beating it.
No, and that's amazing. Nick is exactly right. If it doesn't feel right, go get it checked and let's talk about it. We need to talk about our gut health more often because let's face it, we all have them and we all need it to work, right? And so it's Colon Cancer Awareness Month this month, and we want to make sure that you know what you need to live your healthiest life, just like Nick did. And we're so glad, Nick, that they got it. You're cancer free.
Yes.
And no chemo, which is amazing.
No, I had no chemo. So, like I said, it was a crazy month, but that was, I'm very blessed. The day after I got out of surgery, January 29th was the day I left the hospital after having surgery. So I was there for a week. And then I went home on the 29th. The 30th, my wife threw a pregnancy test and told me I had to get better. So didn't really have a choice because baby 3 was on his way.
That's a lot.
Yeah, that's a lot for from January 11th to January 30th. Those 19 days were.
That's a lot of emotion.
Yes, a lot of emotion in 3 weeks, but addition's better than subtraction. So
happiness, sadness, shock, excitement,
shock,
certainty. More shock, new baby mass tumor. And,
I think the tumor did weigh more than my son did when he was born. It's pretty close.
Pretty heavy, huh?
Yeah. So,
if you put them side by side.
I wouldn't want to do that, but yeah.
Well, we're so glad that you got what you needed done. Dr. Raley and everybody just knocked it out for you and that you're on the right trajectory.
Yes, and I have to give Dr. Raley I have to give Mary a plug because she's the one behind the scenes that makes sure that Dr. Raley is as great as he is. So shout out to Mary.
Mary's pretty great. Mary is Dr. Raley's nurse and she keeps him trucking. She does. So our doctors can't do what they do without their nurses, and they'll tell you that.
Yeah. And there's a lot of great nurses in the OR at St. Vincent, like Lisa Brock. That's one of our good friends. One of our good friends. So shout out to her too.
That's right. Well, it takes a team, and here at St. Vincent, that's what we always say: is it takes a team, and we want to be the team to help the folks that
y'all have a great team and a great staff. And like I said, from my stay here, It was a great, to have colon cancer, it was a great experience. Everything, from the nurses to everything went great.
That's
From
amazing.
surgery to surgeon. So I'm blessed. I would always recommend
Well, good.
coming here.
Well, thank you.
So,
And thank you for talking to us today, Nick. So guys, we're so excited to have talked to Nick today, especially during Colon Cancer Awareness Month. So thank you so much. But next month, who knows who we're going to be talking to? So come back next month to hear more stories from our patients. And who knows, they might be even more crazy of a story than Nick is. I'm not sure though, but it could be. So tune in next month. Thanks for joining us for today's episode of A View from the Bed, A Patient's Perspective. We hope that you found it helpful. We hope that it helped you make your healthcare decisions. We hope that it made you feel a little more comfortable with your own journey. And we hope that you'll join us next time.